Happy Wednesday. It is Wellness Wednesday with Jennifer Yarn Agency. Thank you all that continue to follow, subscribe, and stay tuned to what I have to offer and the amazing guest speakers that I bring to the table every week. This Wellness Wednesday, again, we have our resident doctor, Dr. LeGrande, that is here with us today. Good afternoon, Dr. LeGrande. How's it going?
Oh, it's going. Thank you so much for having me on again. I'm loving this.
Yes, you are our resident doctor with so much going on, and we're staying home, we're staying safe. The world opened up a little bit with first level of businesses that are going back to work, and things are moving around in the community. But we still need to stay safe. We still need to protect ourselves.
Absolutely. Please don't get comfortable. Don't let your guard down. In my opinion, I think we're a little premature, but I understand the economy has to get back on. I mean, I feel so bad for our leaders who have to make these decisions, weighing our safety with our money. So, you know,
they have to make some strong decisions.
Yeah, it's really, really hard. And I know people need to get back to work. I know people need to be able to feed their families. And it's, I heard a lady who had a nail salon end up going to jail trying to feed her children,
Wow.
because she was trying to do what only she knew how to do.
Wow.
But, what can I say? It's a very, very sticky situation, but thank God that, we as medical professionals have an opportunity to educate the community, which I think is really important. Education is so key in these circumstances. It's not necessary to be fearful. It's important to be informed, and that's the key. And so when they open things up, that don't mean you go crazy with it.
Right.
It means if you still wear your mask, you still stay 6 feet away, you still don't hug, you still don't shake hands, you don't do any of that anymore for a long time.
Yeah.
It's okay to go to the store, and I'm looking forward to go to TJ Maxx. Okay.
Right. I need some shop therapy, but we still got to stay safe throughout this time.
I have my gloves and mask on while I shop.
Yes, ma'am. You said something that was so that hit point for me. You said, we have to stay informed. That is why we do our live times. That is why we're doing our Wellness Wednesdays with you for the month of May, so we can stay informed from your platform, from your view of mine. And with telemedicine that you have, really been soaring with throughout this time, with people needing to see doctors and not be able to get out of the house, I wanted to talk more about that this week to see, as a medical professional, what have some of your challenges been with doing telemedicine since the last time we've talked?
Well, I actually haven't had many major challenges, but I have some really good, exciting testimonies or stories that have come through the primary care component of My MD to Me. And as I was telling you earlier, My MD to Me has two sides to it. It's like your extension of your primary care physician, because it is an extension of my primary care practice. I'm a local physician who has a practice in Tampa and in St. Pete. I can do primary care in any of those places. And so you put a face with not just a name, but a place to go if you need to. That's most telemedicine companies are doctors who are all across the nation who you may never ever, and you won't ever meet, not in person. And so continuity of care is very important. So on one side of the coin, in regards to being an extension of primary care, I love it because my regular patients and patients who I get to know who come to my office, I get to be able to see things that I ordinarily wouldn't see. Like during this particular time where we're all staying at home, I have a primary care patient that's diabetic.
Okay.
And I send her to an endocrinologist. I've sent her to different specialists because of her disease process. She'd been doing pretty well, but I hadn't seen her in over a month, because almost 2 months now, because of the COVID-19. But I saw her via telemedicine on yesterday. And since the time that I saw her until today, she has developed an ulcer on her lower extremities, on her ankle, that was really, really bad. It was necrotic. It was bad. And when you're diabetic, that's one of the things that we have to be so concerned about is the
Okay.
development of ulcers because of circulation problems associated with diabetes.
Okay.
Small blood vessels are affected in diabetes. And so she was in pain. She was it was bleeding, which was really a good sign, because but all around the skin was black as tar. And I knew that if I had not seen her until this stay at home had been lifted, which might be, I don't know, summertime. I don't know when this is going to totally lift.
Right.
She would have been in a lot of trouble. So it was so bad that we admitted her to the hospital that day. Um, and she's still in the hospital, and we're praying that she doesn't lose that limb. But I'm telling you, that happened in 30 days. Okay. And so telemedicine allows us to, even if you can't come into the office, if you're bedbound, if you're an elderly person that has a hard time getting to the office, if you have some sort of disability that prevents you, if you just don't have transportation,
Mm-hmm.
but you need to see your doctor, this is what MyMD2Me allows. It allows you to be able to see your doctor even if you can't come into the physical office. And so I am so glad that we had an opportunity. I called the daughter of this patient yesterday and just thanked her for, because she's the one, because the patient was laying in bed. She hadn't told us what was going on. We were talking to her and having our regular, she did not tell us. It was the daughter who says, well, Mom, tell her about your ankle. And then she put the camera on her foot so that we could see it. And we almost passed out. It's like, oh my God, when did this happen? So it's amazing. So if I had not been able to see that, her telling me about it was one thing, but to be able to see it, it changed everything. And she's in the hospital right now because of it.
Wow. So to me, that just says that time is of the essence.
Yes.
Don't sit around and wait. If lumps develop on your body, if you're feeling different things that you did not feel before, to reach out and to take some action for your health. With this patient of yours being diabetic, is there certain things that she could have possibly done that would have avoided whatever she went through, or this is just something that naturally happens due to her illnesses?
It does. It happens naturally. She could have been walking and bumped her vision is going, for one thing.
Okay.
So she's having a trouble getting, around in her space. And so I don't know if this happened, but it's happened so many times with other patients where they can just sort of bump on the side of the bed, and it could just be like a little nick.
Okay.
And within a matter of a couple of weeks, it turns into this horrible looking ulcer because of diabetes doesn't allow the circulation in that area to clean that area. So the small blood vessels called capillaries that's in all over our body, those small blood vessels are compromised with diabetes when there's sugar in the blood. And what happens is that it doesn't take away the bacteria, and it doesn't help heal the small wound. When you nick yourself as you walk by on a metal bed, kind of catches, it just pulls a little bit of your skin.
That's happened before. That hurts.
It hurts, but it heals.
Okay.
So, but with a diabetic, it doesn't heal. And when it doesn't heal, the bacteria sets in and it develops an ulcer. And so the skin then and the sore that it has created, the bacteria continues to destroy that area. And so there's a breakdown of the actual tissue. And so an ulcer develops. And that ulcer can get so bad that it can become gangrenous. And has a really bad odor. When it starts doing that, it's really, really too late. And so a lot of times that happens with diabetics because they sometimes don't have feeling in those extremities as well, because the diabetes affects the nerves. That's called neuropathy. And so the nerves in that area, they can step on. I've had patients step on a whole sewing needle and didn't even know that it had stepped on it, and it had been in their heel for months, and she ended up losing her whole foot. She never felt it go in. And so because they don't have the the normal sensation,
Mhm.
because the small blood vessels don't work the way they're supposed to, that makes a perfect storm for infection. And so the tissue becomes necrotic, means that it dies, develops an ulcer, develops gangrene. And that's how diabetics lose toes, lose feet, lose legs. That's how that happens.
Wow, time is of the essence with taking care of your health, with paying attention to differences of your body. It's Wellness Wednesday, and we are here with our resident doctor, Dr. LeGrande, focusing strongly right now on telemedicine to be able to help you while you're home, refill prescriptions, pay attention to some health issues that you might not even think is that serious until you talk to a doctor.
Right.
You mentioned that you had some great testimonials and things going on this week. That's great. That's what we are encouraged by, I believe, as entrepreneurs. I know I am myself. Is there anything that really touched your heart? Well, you saved a person's life this week. I think that alone.
Well, that was the biggest thing that happened this week. But one of the things that you asked me was, what could she have done to prevent it? It's not so much what she could have done at that moment, but anyone with diabetes, and I just want to put this out there for those who are listening, if you know you're diagnosed with diabetes, your whole life has to change. And it has to change by primarily what you do as far as nutrition. Basically, the entire process of diabetes gets worse if your nutrition doesn't change. And just taking insulin or medications to lower your blood sugar does not fix the problem. It doesn't. It doesn't fix the problem. What you eat means everything.
Yes.
So basically, if you, to just put it simply, you stay away from carbohydrates. Period. Like my sign says, point blank. Period. You stay away from carbohydrates. What are carbohydrates? Starches, rice, pasta, bread. You just don't eat them. Now, can you eat a little bit here and there? I can say yes, and you can, but you know as well as I do, if you eat a little bit, you're going to eat a lot.
Right.
You don't. You can eat lentils, certain types of beans. You can eat other vegetables that's not starchy. No potatoes, no rice, no bread, no pasta. If you do have something, say like New Year's Eve when you have your black-eyed peas, and you have and ham hocks. Okay, that's fine. Just don't eat it over rice.
Right.
Just don't eat it over rice. Don't eat it over rice and have a big piece of cornbread. If
you got to make some decisions when you're talking about what you eat, what you put in your body, for sure, which is going to be able to help you have a stronger health and avoid maybe going into some of the things that you could possibly be diagnosed with.
Absolutely. And so if I could say anything about my patient that we're talking about,
okay,
it's not what she could have done then. It's what she needed to have done long time ago, so that she would not be in the position that she's in right now. And that's usually, that's the case with all of us. We all have neglected ourselves in certain ways. We all have done things that we wish we hadn't done, and we're in a position where now that we have to deal with it, and so we deal with it. So my advice to those who perhaps have diabetes, or perhaps don't know if you have diabetes or not, that's another subject. If you don't know, you need to know. There are symptoms of diabetes that you need to know. For instance, if you're very, very thirsty and keep drinking a lot of water, your body's trying to dilute the sugar, that you may be diabetic. If you're drinking a lot and using the bathroom, urinating quite frequently, that could be diabetes. If you are losing weight and not trying to lose weight, that could be diabetes. Those are the three major symptoms of diabetes. And so you may be pre-diabetic and not have any of those symptoms. And the only way to know that is to get blood drawn. You need to go to your doctor and get a physical examination that includes blood work. So you check your hemoglobin A1C is what it's called. That gives us an idea of how well your body is handling glucose, which is sugar, in your body over a period of time. If that's elevated, that tells us that you may have what we call pre-diabetes, which indicates you are at high risk for becoming diabetic.
Wow. That was a lot. That's a lot of information. If you're watching today, it's Wellness Wednesdays with our resident doctor, Dr. LeGrande, primary physician that can help you in all of these areas that we're talking about. So if you think you may be diabetic, if some of these symptoms hit home for you, definitely click the link at the bottom of this screen. If you do not have a doctor, if you're wanting to have a consultation with Dr. LeGrande, she's available. Don't wait until all of this stuff passes. Don't sit down and let your health fall at the sides. You know, time is of the essence. I appreciate this information. We got a couple of viewers. Hi, Daryl. I know you say you appreciate this information. So if you don't have a doctor, again, if you need to reach out and just have a consultation, or if something on your body is different than what it used to be, telemedicine is the answer. There's, guess what? No waits. You don't have to sit in the doctor's office and wait for hours at a time. It's very simple. You go to the website that's below, look around, check it out, schedule an appointment. It's VIP concierge. I don't know what else is if you can't just click a link and see a doctor on your tablet or your smartphone.
Absolutely. And that's, and even if you know you want to come in and get a hands-on exam, this is a good place to start. It's a good place for a consultation. Then you can make an appointment to come to our brick and mortar building. Or if you already have a doctor, you know, once you have a consultation with us, you have other questions that you can ask your primary care physician to move forward. One of the things that doctors still don't do well, and I apologize for that, is spend time enough with our patients to hear what they have to say. That is something that I take pride in. I believe that I'm a good listener. I talk a lot, I do, but I love to listen.
Yes.
So I think that's important for a physician, is to be able to allow the patient, the person that's there, that's trusting them literally with their lives, let them talk. Let them tell us, you know, what's going on in their lives. And a lot of times, people come in for one thing and find out about something totally different.
And you heard it from our resident doctor. It's Wellness Wednesday with Dr. LeGrande. If you're watching right now, be sure to like Dr. LeGrande, My MD to Me. They're on Instagram. They're on Facebook. Like it so you can get some of the tips and resources that are shared on her platform daily, and get connected. If you need a doctor, telemedicine, this is the time to jump right on in with a doctor that cares, a doctor that listens. It's Wellness Wednesday, and we are here with Dr. LeGrande. Any final words, Doc, before we close out today?
Just stay informed and being connected to MyMD to Me, and reading what the blogs are saying and what the content is in on the social media platforms are saying, paying attention to it. If you have any questions, you are certainly welcome to go to mymdtome.com, make an appointment. We can sit and talk as long as you need. Answer your questions as much as we can, and send you to the direction, if we can't answer, that perhaps you can find those answers.
Yeah, and if you have questions, definitely send us a message, and we will gladly push it over. If you don't seem to find Dr. LeGrande, but she is out there, My MD to Me, on Instagram, on Facebook. Those links are also in this live, and her website is running across the bottom. And never forget, we are here all throughout the week with Live Time with Jennifer Young Agency. Subscribe to our YouTube channel, and you can see all of the videos from our past and know what's coming up this week and for the month. Thank you so much, Dr. LeGrande, for giving us information, keeping us informed about diabetes, for saving a life this week. We need more doctors like you on our platform. So thank you again for taking this time and during this busy season to talk to us about your week with telemedicine.
Amen. Thank you.
All righty. Have a good night. You all stay tuned, and don't forget to subscribe to Jennifer Young Agency IBA Success on YouTube. Have a good night.